Moving on to our next session, let me know in the chat how many of you, if you're a practitioner, you're struggling with making your patients, your clients avoid gluten. Or if you are a patient yourself, you're struggling to give up gluten. We see this in our practice every day. And to know when to avoid gluten and when to keep it in the diet, we have Dr. PRITI NANDA SIBAL with us today. She doesn't need an introduction. I'm sure all of you know her. She's the president of IAFM and CEO of MBBS Health Services. She also holds an MBA and a certified executive coach. Her practice is based in Gurgaon, and her expertise has been in obesity, diabetes reversal, gut-related issues, autoimmunity, BHRT, and most other chronic conditions. So over to you, Dr. Priti, to share with us all about gluten.
Thank you, Ruhi, for such a beautiful introduction and most importantly, hosting everybody on time. Thank you. So, yes, yesterday, when it struck me that I have taken this topic, I was thinking, why do I always get myself in such a situation? You know, it's a very controversial topic. I am sure some of you will agree with me and some of you will not agree with me. And that is perfectly all right, because I think the science we are in, functional medicine, it is very important that we agree to disagree, right? So 8 years back, when I came into functional medicine and I was told that I have to eliminate gluten and dairy, every meeting, gathering I used to go to, I used to see that 90% of whatever was served was either gluten or dairy. And therefore, I had to come back without having anything there. This continued for a few months, and then I decided, no, this is not the way I want to live. I am a Punjabi. Without gluten and dairy, I won't be able to have anything. And I started introducing foods back. I had some learnings then. And after that, I think I have almost helped 5,000 people do elimination diet in the last 8 years with me. I have seen some magical results by avoiding gluten in some patients. But at the same time, I've also seen that a lot of patients have, over these years, been able to introduce gluten back in their diet without any side effects. I am from the second category. Right? In the beginning, when I avoided gluten, I felt a lot of relief. But when I introduced after doing whatever things I did, which I will share with you in the presentation, today, I see no symptoms, no weight gain, no lethargy, nothing of that sort when I have gluten. And I have many, many, many more people like that. So when I was researching for this talk, some very interesting things came up. There was this study which I read which said that schizophrenic patients were studied by a group of scientists to figure out whether every schizophrenic benefits by going off gluten or not. So in the chat box, what do you think? I know we have majorly people here who think and strongly believe that gluten is not a good food to have, right? Yes? How many of you think what percentage of schizophrenics were shown to be intolerant to gluten or were shown that they benefited when they avoided gluten? In the chat box, please. So my session is going to be a little interactive. I don't think you will see a lot of slides here because I think this needs more discussion than teaching. So anybody in the chat box who can share with me, how many of you think, I really like this answer. Some people are at 50%, 60%. And Mangla, thank you very much. I think you have read this study. You are bang on. Only 15 to 20% of people were found that they were allergic to gluten. And those were 15 to 20% people were the ones who were told to avoid gluten for benefiting them. Now, my question to all of you is, do you think it is worth that to give relief to 20%, to the remaining 80%, We actually don't give them many options to go and mingle and eat, at least in today's state in India. Right? I think yes, we cannot generalize. I think all of us here know the challenge we face if we are on a gluten-free and a dairy-free diet when we go out. Even in places where they say they have gluten-free menu, there is a lot of adulteration. Yes, Dr. Raja, I think you're very right. Our epigenetics has seen gluten. And it's not been many years that we have changed or evolved our genes in a way that we cannot have gluten. So, and that's the reason I took this topic, because I really wanted all of us together as a community to start thinking and deciding who should take gluten and who should not. And I will, of course, give you my consensus of working with gut health and other chronic diseases in the last 8 years, where I have come to. Definitely, Dr. Ashwani, but I am going to counter that also, what you have said. Glyphosates are playing a huge role, yes. So we have to find a way in between. And I am sure by the end of this presentation, I don't know how many of you would agree, but you would at least start thinking. Yes, South Indians have seen only. So let's write. So when to avoid gluten and when to keep it in the diet, a practitioner's guide. And what I'm going to share with you today is what I have learned by working with 5,000 patients in the last 8 years, helping them do elimination diet in groups. So the question I think I am asking everybody and myself for last few months since I've taken this topic is, should everyone avoid gluten? And let's first see what is gluten, why it is the talk of every health meeting today, what are the sources of gluten, and gluten-free diet. Is this a truth or something which should stay and something all of us should abide with? Or this is just a fad and people are making money out of it? So if I have to take a quick poll from the people here, what do you think? Is gluten-free diet going to stay, and is this a truth for all of us? Or this is a fad and people are using it a lot more to make money than to creating health? So if we are with truth, give me 1 in the chat box. And if we are with you fad, give me 2 in the chat box. So I like it. We have a good mix of people. We have good 1 and 2s. And I think I'm extremely happy with this, that we have almost equal number of 2s to 1 here. So this is going to be a very interesting discussion. Exactly. And I will show you with data what it looks like to me after doing whatever research was there. Of course, the research is not too much. So let's first understand that when we talk about gluten, how did this concept of gluten-free diets emerge? It especially came up for celiac patients, for non-celiac gluten sensitivity patients, for non-celiac gluten sensitivity with digestive symptoms, with autoimmune disease, and people who did not benefit only by removing gluten. This concept of FODMAP intolerance came. But you will see that at the most, all this is 50%, not more than that, right? So Samuel Gee in 1888 was the guy who first brought this concept of celiac disease. Till then, people with celiac, they were not diagnosed and they were not able to live for a long time. In fact, between diagnosis and treatment, whatever was available that time, lot of people died. So generally, celiac children used to look like this: chronic or recurrent diarrhea, abdominal distension, anorexia, failure to thrive or weight loss, abdominal pain, vomiting, constipation, irritability, which was called celiac crisis. We don't see it now, right? Of course, why? Because we diagnose it much earlier than the diagnosis time that time. Now, the treatment for these children was, that time Dr. Samuel figured out that giving them bananas. So because bananas are rich in carbohydrates, they provide you enough nutrition. They, after eating few bananas, you don't feel hungry. He found out this way. This was 1905 to 1962. And 1938 was when W.K. Dick diagnosed first celiac disease patient, right? And in this article where I was reading this, the editor or the author had written, that not to miss saying here is that these children never wanted to look at anything yellow after that, if they survived this period, right? And from here to where we have reached, our understanding about this disease has grown multiple folds. And now we know that it is an autoimmune disease. DQ2 and DQ8 are present in more than 95% of patients of celiac disease. The environmental trigger is gluten, and generally tissue transglutamase antigens are present in these children. And therefore, this is the test we generally do. We do genetic testing, we check for antigens for tissue transglutamase, and accordingly, we diagnose the patient as celiac or gluten sensitive or not. Of course, we don't have any good test to know gluten sensitivity, and I'll tell you what I have, figured out as a solution to find out which people are gluten sensitive and which people should avoid gluten in my coming slides, right? So this is it. Yeah, genetic makeup, gluten, together in these patients where celiac disease happens, we now know it's an autoimmune disease, changes in the gut lining happens, and that's when celiac disease happens. We also now know that even adolescents and people at the age of 30, 40 years are also being diagnosed with celiac. And I think this observation only made us firm up this hypothesis that celiac disease is not purely genetic, right? Why? Because genetic, if it would have been genetic, it would only have been present in very, very young children. It is an autoimmune condition, and that is the reason it can happen at any age, even at 30, 40. So I get a lot of celiac, at least in the last 1.5 years, I get at least 1 or 2 celiac people in the age group of 25 to 40, right? They are diagnosed at that age and they're very shocked with the diagnosis. But their symptoms are there, their antibodies are there, and if they check the genes, their genetic makeup is also towards celiac. So now we know this is a pure autoimmune condition. And because it's an autoimmune condition, we also know that there are some triggers which lead to this. So I've listed some of them for us here. And please, if you have any comments, do write in the chat box because I would love to address them as I go in the presentation. Quality of gluten. Yes, Dr. Ashwini had mentioned this in the chat box just in the beginning of thing. Quality of gluten has changed. But is that the only reason why we should avoid gluten? I think today I will say no. How has quality of gluten changed? In the beginning, if you remember, when gluten came, right? And I will speak how gluten also came in the coming slides. You will see that we had dwarf gluten and the percentage of gluten in the wheat was only 4%. Over the years, that percentage of gluten increased to 8%. And I'm sure a lot of you know that we always talk in our talks that during industrialization, the wheat became, we needed more product, we needed more growth, and therefore genetic modifications were made. And from the dwarf gluten, the gluten was made long and tall gluten. Now this wheat has 12% gluten. So from 4% to 12%, anybody from science background here would know that there is a threshold to everything. So if you could have digested 4%, maybe a lot of us were not able to digest 8%, and a lot more now able to digest 12%. And this can be one of the reasons why celiac disease incidence is increasing over the years, and it's increasing phenomenally. The number of celiacs we see today are almost 50x of what we were seeing about 50 years back. So the growth is humongous and it is scary. We need to do something about it right now. Quantity of gluten, I've just shared. Breastfeeding. Extremely important, and you will understand this in my later slides. Our microbiome plays a very, very important role when it comes to protecting us and giving us that ability to digest gluten, right? And therefore, as cesarean sections are increasing, and during my research for this presentation, I read articles where they had said that there are countries where almost cesarean section incidence is reached to 90%. I am not saying cesarean is bad. Till the time cesarean sections were not being done, a lot of women had to lose their lives, right? But the problem of having cesarean section arises when mothers by choice do it, doctors by choice do it, because both have their personal interests aligned. Mothers are not well informed and therefore they do it. Doctors, despite being informed, their interests are very, very different and therefore they don't care of all the information they have and then they do it. And then breastfeeding. If we don't do breastfeed, if we only do artificial feeding, it can really decrease the ability of your gut to digest or absorb gluten, right? Timing of gluten introduction. I'm sure we all here think that timing of gluten introduction is important. I also used to think this, but now I'm debating. No harm decreasing the introduction of gluten. It's a good practice. We can do it. But is it extremely scientific and proven in studies? I will show you later what at least I digged out when I was researching on this. Maturity of gut function, especially mucus production, barrier function, galt, all of this makes a difference whether we will have celiac or not. And of course, most important is microbiome composition. I will leave it for my future slides where this is going to be the key player in helping all of us decide what will be our take from tomorrow. So cesarean sections, come with breastfeeding. They are not connected, but I had missed writing cesarean section here, so I discussed cesarean section also for our benefit because it is playing a huge role in what's happening today. So immunity means, autoimmune condition means inflammation. Gluten causes inflammation in the gut. We all have read data that none of us as human beings, we are not able to digest the proteins, especially the gliadin, completely. We all know that whenever we eat gluten, it has to be broken down into amino acids so that body can digest it and use it properly, right? Now, gliadin, glutenin, these are the two amino acids in gluten which are difficult to digest and they create inflammation. Yes, I agree that as humankind, we are not able to digest these completely. And therefore, they cause inflammation in all of us. But is that inflammation leading to disease in all of us? Data today says no. Why? Because a little inflammation is good inflammation, the way little stress is good. How many of you here agree that little stress is good? A little stress helps. A little stress that I had to present on this made me go through so many articles which I had not bothered to read in the last 8 years. Right? Similarly, a little stress from gluten can be good provided the other things are kept in place. Of course, in aging, in Alzheimer, asthma, atherosclerosis, bowel disorders, cancer, COPD, cirrhosis of liver, cystic fibrosis, diabetes, meningitis, autism, osteoporosis, prostate cancer, psoriasis, RA, and other schizophrenia. Everywhere inflammation caused by gluten is playing a role, but in not 100% of people. Studies have shown anywhere between 20 plus, but even if we take into account everybody who doesn't feel very good with gluten, it won't cross more than 50%. So, and is there a way or is there something that we can do in the coming years that we don't have to get gluten out of our eating plate, but we can include it in different ways? So a lot of people have, given me the confidence and the intent to look into this topic. And one of them I would definitely want to mention here is Dr. Renu Madani. I am sure a lot of you know who she is, but all those who don't, she was suffering from a autoimmune disease. She's a critical care medicine doctor, very learned, very passionate, very renowned. She practices in Pune. And when she was trying to find solutions for herself, she figured out that high dose vitamin D, which is Coimbra's protocol, helped her the most. She quit gluten, dairy, everything. But 3 years back when I did her course, I asked her, because I don't quit gluten and I've never had to, because somehow gluten has never given me that much of trouble where I can lose the taste of my pranthas and, get off gluten. She said, no, Preeti, I have changed the way I use gluten. I have changed the quantity and I have changed the way I eat. And I have also worked a lot on my gut. There are a lot of other people. There's another doctor I really highly respect in India. And he came to dinner at my house and I asked him, will you have normal roti or gluten-free roti? And he said, no, normal roti. And I said, you have not quit gluten. He says, I don't have to. And there have been many, many, many such experiences. Of course, there have been other experiences also. I know that me and Dr. Aarti almost studied at the same time. Right? We both enrolled with A4M and we both used to discuss whatever, A4M was teaching us. And the biggest debate we always had was she had completely gone gluten-free and her whole house was gluten-free now. And this is about 5-6 years back. And in my house, everybody was having gluten. And, every time we used to speak, she used to spend 5 minutes with me telling me, Preeti, this is not done. If you're into FM, you need to avoid gluten. And I would say that, Dr. Renu Madani, Dr. Pankaj, Dr. Anupam, Dr. Aarti, and many others, none of us are wrong. I think we are just seeing different sides or different type of people and treating them differently. Now, all of you who are making people go gluten-free would know that a lot of your people only after leaving gluten don't feel good. At least I have seen a lot of people. I have seen people who were not able to walk. Only by removing gluten and dairy and soya and eggs from the diet, they have been able to run marathons. And one of them was a doctor's wife. And she especially flew down to meet me and thank me because only after going gluten-free, she saw this miraculous change in her body. There was a lady who had severe migraines. I worked with her for 6 months. She used to take morning tea every day. And we were able to improve, but we were not able to get rid of migraine for her. Right? And then I convinced her to skip milk tea that she used to take in the morning with just, 2 spoons of tea. And her migraine went away. So when we are allergic to any food, when the food is causing inflammation in our gut, I know how powerful removing that food can be. So some people don't get benefit by going gluten-free. Few reasons I've seen are, one, if they have gut infections, only going gluten-free will not help. And of course, most of the people who will come to you and me would, with the awareness we are creating, would have tried elimination diet before they have come to us. So ruling out infections and treating infections will play a huge role. Histamine intolerance in a lot of people.
2 more minutes.
2 more minutes. I thought I won't be able to cross 30 minutes. Okay. So what I want to tell you is cause is different. Solution also needs to be different. And let's look at how agriculture evolved. This is how the wheat changed. And this is the story which I read, which is very interesting. You know, men used to go out for hunting. We all know, and women used to stay at home. And we know women are multitaskers. So what this woman saw was that wherever the seeds used to, be seen, plant used to come. And over a few months, these women started planting these seeds. And this is how agriculture evolved in our country, in the world. And that is how celiac disease roadmap has been created, right? And therefore, agriculture is considered to be one of the reasons why we are not able to, why gluten came into our practice, and changing agricultural practices like pesticides, like genetic modification is now making us think why we need to avoid these practices. So as agriculture increased, our diseases increased. Zonulin was found, and this is known to be causing 1,300 genes. Now, this is what I want to leave you with so that you can think. This is observations from a scientist who was given Nobel Prize for finding zonulin. Window of tolerance concept, which said 4 to 7 months best period to introduce baby foods, not supported anymore. The duration after which, if you introduce gluten, can help you not be allergic to gluten, not supported anymore. Breastfeeding is found to be positive, but cannot help children who are at risk of celiac disease. Early introduction, that is within 16 weeks of gluten traces, potentially induced tolerance did not protect against celiac disease. Delaying the introduction to 8 months does not help. GI infections during the first year of life seems to be influential, increasing the risk of celiac disease or gluten sensitivity. So this is now what we need to look at. High-risk HLA profiles seem to be the most influential factor predictor of increased risk of CD onset. So only 2 things out of all what we were thinking are important for us. History of infections in childhood, history of antibiotic courses in childhood, and also your genetics. Over the years, the way we use bread has changed. We used to ferment before making bread when it started in Egypt for 12 hours. Now that fermentation has been decreased to 1 to 2 hours. Fermentation helps digesting the protein better, which has gone away. And please remember, complexity of human being. We are only 10% human genes and 90% microbiome. And we are forgetting the microbiome. Microbiome is most important. With human genome, it makes metabone. And therefore, what we can do and should do is restore your gut lining. Follow the 5R protocol, and you will see that after 3 months or 6 months, in almost 50% of your patients, or say 30% of your patients, you will be able to include gluten, dairy in minimal quantities, right? There are a lot of studies to show that gluten, Rui, I'll just take 1 more minute. There are a lot of studies to show that when we avoid gluten, there are a lot of side effects which happen. Fiber decreases. So when we go gluten-free, finding ways to increase fiber in our diet are very critical. Imbalanced micronutrients like zinc, folate, vitamin D deficiency start happening. Cardiovascular risk and insulin resistance increases. Because remember, when we go gluten-free, the carbohydrates which we take increase, the junk food also increases in a lot of cases. Cost goes higher, and the gluten-free food which is available in the market, a lot of it is junk. And therefore, we can't say that anything which is gluten-free is good for our health. We have to be cautious. Eating out and socializing becomes a lot of stress. Quality of life at times can decrease. Now, very important, it has been found that in gluten-free foods, heavy metal levels are more, especially arsenic and mercury, which can be a killer of health
Will
for
you
all of
stop,
us.
Dr. Preeti?
30 seconds. Thank you. So we need to keep this in mind. And therefore, yeah, this is what I will want to end with. There are people who need to avoid gluten. There is medical necessity and no medical necessity. As health coaches or doctors, it is our responsibility to find people where it is medically important and it's a medical necessity to avoid gluten. In people where it is not a medical necessity, I think we all should follow that concept of detoxifying twice a year, the way we do in Navratras. 3 weeks, go off gluten, introduce gluten back, and see whether gluten suits you or not. If it does, have it in moderation and stay healthy. I will be happy to take questions. I had a lot of studies which I had wanted to show you, but no worries. Please feel free to share questions and I will answer. And let's be more conscious about who we tell to avoid gluten. Thank
you,
you.
Dr. Preeti. There are a lot of questions, so I request you to please stay back and answer the questions in the chat.
I will answer all the questions. Thank you.
Thank you.